1,075 in the last 24 hours. Of positive cases in the country to 16,268. And our cumulative cases stand at 266,102. From the cases, 657 are Kenyans, whereas 10 are foreigners. 393 are male and 274 are female. And the youngest one is a 1-month-old infant, while the oldest is 92. And in terms of distribution by county, we have Nairobi leading at 387, Kiambu at 40, Mombasa at 26, Machakos 47, Kajiado 79, Nakuru 15, Uasin 14, Garissa 11, Busia 9, Kilifi 6, Turkana 6, Makueni 5, Wajir 5, Kisumu, Nyeri, and Lamu having 4 cases, Murang'a 2, and Bomet, Bungoma, Narok, Nyamira, and Vihiga having 1 case each. And again, we've provided a distribution when it comes to sub-county disaggregation. And for Nairobi, again today, we have Dagoretti North leading. Yesterday it was Kibera, today Kibera is second at 32. We have Westlands having 32 cases, and Embakasi East having 30. And the situation continues in each of the counties, with the hotspots leading in terms of numbers. Again, to mention a few, in Machakos, Athi River remains as the lead with 41 cases. In terms of Kiambu County, we have Kikuyu having 13. We have Kiambu having 6. We have cases in Gatundu South, Kiamba, Lari, and Ruiru having 4 cases. And in Mombasa, Mvita again leading with 13 cases, and Jomvu having 9. And we've provided for you the disaggregation by each county, by each sub-county, with the highest county to the least county. On a positive note, 311 patients have recovered from the disease, and out of this, we've had 166 from the home-based care program, while 145 from various hospitals. And this brings the total number of recoveries in the country to 7,446. And we continue to thank our healthcare workers for this achievement. Unfortunately, we've lost 11 patients from this disease, bringing our fatality to 274. And what was striking for me today as we reviewed this mortality data is that we've actually lost a child due to rickets. And I found it necessary to really highlight this today, because even as we impose physical distancing, even as we say stay at home, then it means that if our children are staying at home, particularly those who live in apartments or areas where there are no fields, then it means that there's a risk when it comes to rickets. And how to take care of rickets is to ensure that your child has access to vitamin D, which is best sourced from the sun, and a healthy diet. And so the fact that for the first time we've actually had a fatality, and that this child had rickets, really is a cause for concern. It means that we need to relook, to see as parents, even as we have our children in the houses, how can we ensure that there is an element of sun exposure and, of course, healthy diets. We continue to pass our sincere condolences to the families and friends of those who have lost loved ones during this pandemic. And finally, we would like to reiterate that our health facilities countrywide continue to be operational for treatment of all other diseases, not just COVID-19. And therefore, we appeal to people not to shy away from utilizing services, and this includes the HIV testing services that we've discussed today. We have seen a decline in terms of service utilization, and we do continue to remind you Kenyans that if you are unwell, you should go and seek care at the health facility. Our healthcare workers remain ready and willing to attend to all ailments and not just coronavirus. So let us make use of these facilities. Thank you.
Dr. Ali, my name is Elfas Legat from Citizen Television, and my question is on the increase of caseload. Especially the last 3 weeks have particularly been revealing in terms of numbers of positive cases. Where are these numbers from? Are they targeted mass testing, or is it contact tracing? And again, we understand that there are government institutions that have ordered their staff to be tested. If you can kindly give us a breakdown of the same. And also in terms of facilities, hospital facilities, with the numbers, you've mentioned before that in the coming weeks, the numbers will peak. How are our capacity in terms of hospitals to handle these rising numbers? And also, Daktari, there is the aspect of stigma regarding the people who turn out positive, and reluctance, particularly from officials from government, to reveal their status. Have you deliberated on this new emerging trend of stigma for particularly patients who've turned out positive? Thank you.
Thank you, Mark Namasa from KTN News. My first question is, I've received a call from a female patient at the Kenyatta University Referral Hospital, a COVID-19 patient. She says she was admitted together with her 3 children, so there are 4 family members there. Then, about a month ago, and then yesterday, one of the children tested negative and wanted to be cleared to go home. The child was told to pay some 90,000 shillings. So when she does her mathematics for 4 family members, if they all turn negative, then the hospital wants close to 400,000 shillings from her. So my question is, when did government decide that people who have been admitted in government facilities will now have to foot their own bills? They claim it is accommodation fee at the rate of 3,100 per day. My second question concerns people who drop down dead. When does government decide that these are COVID-19 cases? Does government go to the step of testing these people who die mysteriously and confirm it is a positive COVID-19 case? Thank you.
My name is Eunice Omolo from NTV. I have 2 questions. The first one, how many people actually need hospitalization in the country in regards to COVID-19, or rather how many people have been hospitalized? Then my second question is in regard to the NMS. They have a plan to set up 24 hospitals in 4 slums in Nairobi in partnership with the Ministry of Health. How much has been set aside for that, and how soon is the project intended to start? Thank you.
I think I can see one more hand from Purity, who is Zalendo, so go ahead.
Thank you. Good afternoon. I have concerns, a follow-up on the HIV status. You said that 96% of people living with HIV who are COVID positive are under some sort of support, life support. Would you break the numbers for us? How many have tested positive, and maybe how many have succumbed to this disease? And then the other concern is you've occasionally talked about the surge or the peak, the projected peak to be around early August or even up to September. What is the level of preparedness in terms of capacity, in bed capacity, and even in counties? Lastly, you've also been talking about utilizing the community health workers. Most of the times, these healthcare providers do some sort of charity work with no pay, volunteering. So is there a budget for them, or how are you planning to make use of them?
Thank you. Thank you all for your questions. I think I'll start with Elphas's question from Citizen, where he has asked where do we get our numbers from? And I think this is a question that has arisen during past several briefings. And related to this is then the question of, are we testing any government institutions? And if we are, which ones are we testing, and can we release those results? What I'd say is that in terms of our testing strategy, we've often, informed you that in national government, the testing emanates from what is known as our Emergency Operations Center. Our Emergency Operations Center is situated at Afya Annex, and I'd really invite you, members of the Fourth Estate, to perhaps also feature that center, because that is the nerve beat of this COVID-19 response. And in that center, we have what we call rapid response teams, and that is where these rapid response teams are dispatched from. So when we get an alert either here in Nairobi or an alert in the counties, that alert is transmitted through the 719 number to the Emergency Operations Center, and their teams are dispatched to be able to either go collect the sample, if it is here in Nairobi, or to coordinate with county rapid response teams, of which all counties have been able to put together rapid response teams. And once these teams are alerted, they then, of course, go to the incident area. They're able to pick a swab, take the tests, and they're able to also initiate contact tracing. So that is how we get our numbers. One of the other ways in which we're able to get our positive cases is in cases where we are conducting targeted testing. For example, testing of healthcare workers, testing of other frontline workers, people in security, testing of different government institutions, most recently the courts. I'm sure you saw that story in the paper. So then we go in there and we conduct testing. Yes, there are various other government institutions that have undergone some form of targeted testing, especially when we have traced a contact to that area. And so this is an ongoing situation that's evolving. And in terms of releasing and sharing with the public, there are mechanisms. The contact tracing mechanism is one of the mechanisms in which immediately a case is identified or a cluster is identified, then the measures needed are put in place. With regard to capacity of our hospitals, and I really want to link this up with Purity's question on, we've talked about our numbers going up. Are we ready? Do we have capacity? Yes, as it stands, and Dr. Kuria will elaborate on this. When we look at our beds, I think Kuria did give a brief recently. We have about 12,000 beds across the country, and the number is still building. Every day, counties continue to increase the number of beds. When it comes to ICU care, perhaps an issue that has really been highlighted in media, an issue in which we've gotten numerous phone calls on. Yes, in Nairobi, there are days when our ICU beds have been full, but remember, across the country, we have about 400 ICU COVID beds that are available. And so in terms of our assessment, we are not yet overwhelmed. We're still under the threshold of raising the alert level. When it comes to stigma, we've spoken to this several times here in this press briefing as individuals. I think we've seen different people, share with you how the testing procedure is done to allay any fears when it comes to testing. And those who, and it is their personal right, and we must respect that personal right, when they do feel like they can then release their results, be they positive or negative. And really this is important, and you as a fourth estate can help us here. If you tested us here as government officials, I can bear you witness, beyond COVID-19, we have other conditions. I'm not sure if Dr. Kefa here wants to have his BP checked right now. Perhaps he's hypertensive. I am diabetic. He probably has another condition. So the idea of expecting that, officers or any individual, even yourselves, would release the results, really, it requires some better management in terms of respecting individual rights, but also realizing that by drumming all that up, it does also aid in creating the stigma. That being said, we continue to really put in place interventions dealing with, talking to the community. And I saw teams this morning sharing their pictures of what they're doing in the field. There are teams in Vihiga now, in Bungoma, talking to the residents, taking them through what it means to pass a swab through their nose, trying to allay that stigma. And we really do ask for your support when it comes to that fight of stigma. There's a question on the COVID-19 or the COVID-19 patient in KU. Thank you for bringing that up. I think I got a report of this case about 3-4 days ago, and we maintain that COVID-19 treatment in public facilities is being handled by those public facilities, and there are no costs attributable to that. And this is a case that we've actually managed, and we are managing to follow through. There are no costs, and the Cabinet Secretary has announced this several times. There are no costs at public facilities when it comes to treatment. And remember, this, again, is another element of stigma, and we had to remove this, cost implication so that people can feel free and ready to receive care when they need it. There is a question of what happens, and this was quite interesting. People are dropping dead, and this has been happening, and I don't want to be morbid, but people have been passing away even before COVID-19. We've received a few cases, in fact, as early as this morning, of someone who passed on in a banking hall. And the thing is, we don't want to create fear and panic in the country. Not every person who is unwell has COVID-19. And when people do present to us and there's suspicions, a history has been taken, or perhaps the death is deemed to be of suspicious circumstance, of course, due diligence is done and tests are done. And we've repeatedly announced in some, past press briefings that we've actually identified COVID-19 patients posthumously after they've passed on. We've been able to take the sample and identify that that was COVID-19 patient or positive case. And so really the idea and the panic that is spreading that, people are dropping down, again, partner with us, the Fourth Estate, to really allay fears and to have Kenyans realize that other diseases are still around within the country. It's not just COVID-19. There is a question on how many people need hospitalization, and I think Dr. Kuria will assist in this, in terms of when we look at the pathophysiology or the pathway of this disease. Yesterday we told you about 80 to 89% of our patients are asymptomatic. So for those patients, we do feel they may not require hospitalization. And for them, management means isolating them. Then there's this other, percentage of patients, 5% or so, who may have more mild to moderate disease. These are patients who definitely need care, particularly because these patients can transition very quickly from mild to moderate disease to severe disease. And some of these patients are on just oxygen and basic painkillers. And then, of course, we have the critical 5%, who will always be very critical and require ICU care. And so when we look at our models, our tabulations, when we look at our current cases of identified positive cases, this picture maintains. This is actually the trends that we are seeing. And so between 5 to 10% are the ones we would need hospital beds for. Regarding a question on NMS setting up hospitals, what we'll do when they're ready, the NMS team will be able to share with you the budget outlays of the hospitals. What I can confirm is we do have about 20 plus hospitals that will be set up, focused in high density areas across the country. And this team really is doing exemplary work, and we continue to champion the work that they're doing. We feel that the setup of these hospitals will be a game changer for Nairobi. We will have level 2 hospitals, and we'll also have level 3 hospitals, and highly focused to providing essential services in these areas. And perhaps in the next press briefings, we might be able to come in with the NMS team and showcase the good work that they're doing. I think we have a question, and this is just to clarify in terms of the statement we've made today for HIV. What we mean is that 96% of all HIV patients in this country are on treatment as they should be, and that's a good thing. We have not said that they have COVID, and it's important to clarify that. What we are saying is that we are happy as a country, we are meeting the targets when it comes to our HIV approach. That every time you identify a positive case of HIV, you're able to ensure that this person is enrolled into a care program. And so we are doing well. However, we are raising caution that with COVID-19 and low-seeking health behavior from ourselves, this may hamper this achievement. And that's what the aim of our message is today, really, in terms of seeking care. We have a question on CHVs, community health volunteers, a very key asset for us, who are doing exemplary work in Nairobi, in different parts of the country, and we continue to really appreciate the work that they're doing. As we speak today, this strategy is highly supported by our development partners. We have UNICEF doing a fantastic job in training them, a fantastic job in monitoring and evaluating the work they do, a fantastic job even in providing kits for our community health volunteers as they move from house to house. We also have AMREF and Red Cross partnering on this initiative. What we do see as government is we're in the process of reviewing to see how we can then adopt these community health volunteers in a manner that is sustainable. And so perhaps in the coming few weeks, we'll be able to share this with you and to highlight that great progress has already been made, because just last week in Nakuru, the Cabinet Secretary was able to launch the community health policy. And in that document, we envision measures in terms of sustainability of these community health volunteers. At this point, I'll invite Dr. Kuria to add in terms of our preparedness and other questions.
Thank you, Waziri. I think we have highlighted this issue of availability of isolation facilities across the country. And you might well be aware that on Monday, His Excellency the President has asked for a summit again between the Cabinet Secretaries and all the governors. We're going to address again this issue of preparedness of the country and the counties in terms of the target that he gave them of 300 beds per county for isolation beds. So as we stand today, we still have the figures that we have. Well aware that there's a team from the Ministry of Health that is going around the counties that's assisting the counties, assessing this capacity indeed, and assisting those that need to be technical assistance in setting up these isolation facilities. So the teams are set up in 11 clusters. They are out there assessing counties and assisting counties to set up more facilities as we prepare for more patients, as we are starting to see our patients going up. So we mentioned last week that we have at least, as of now, 12,000 beds, 12,513 beds, normal isolation beds, and about 498 ICU beds for COVID patients. If you look at our figures today, number of patients in hospital is about 1,179 across all the facilities. And the number of patients in ICU across the country is about 50. So as Waziri said, the capacity is still there. You may be feeling this effect that in Nairobi there are so many cases. Yes, you may have had this going around, but overall the capacity is still there. But we are making every arrangement to improve the capacity also in Nairobi, because this is where majority of the cases are. And I think even as of this morning, there was a strong meeting with Waziri and NMS, and I think even the Ministry of Interior. We are trying to increase this capacity for Nairobi because this is where most of the cases are. And we'll be advising the members for the state and the public indeed on how I am moving by the beginning of next week. There's a question that was raised about where we get our cases, Waziri, and indeed, yes, it is from a rapid response, and as someone mentioned, that we are having a few government offices asking for testing of their members. But we would want to urge members of the public and even the government offices, testing does not give you a sense, just gives you a sense of false assurance that you are safe. So much as you may want to clamor for that testing, it is still, and I will still insist, that it is the measures you take before or after that test that are going to matter. So this need for testing of whole buildings may not be very important here. And our testing strategy, still indicates that we test those who have symptoms and close contacts of those that have been identified as positive, not entire buildings. It has to make scientific sense when you ask for testing for a whole building. This building doesn't, if Waziri is a confirmed case, I have not been in contact with her today, so do I need to be tested when she... So you've got to have sense when you ask for testing. There was a case on stigma and about the strategy, and I think this is where we have said again and again that I can get it, you can get it. And this idea of stratifying people, saying that these numbers from this building or from this strata of population has it, it's not going to help us fight this pandemic. It is how you prepare yourself to fight the pandemic. And the preparedness is being ready to follow the guidelines that we have issued. And they are still simple, the rule of 3. Wear your mask properly at all times. We will not tire saying this, because this is what we need to propagate again and again. Wear your mask properly and at all times. Wash your hands and sanitize them as frequently as possible, and keep your social distance. If you only keep those 3, testing will not be very necessary here. So keep your distance, wash your hands, and wear your mask properly. I think I'll end there, Waziri. Thank you.
And I think that's a good space to end. Follow those 3 rules. We have to end. Thank you. Tomorrow, another day.
Je, ungependa kujua jinsi ninavyojizuia kuambukizwa au kuambukizana virusi vya korona? Ni rahisi. Mwanzo, ninaziendesha shughuli zangu zote za kikazi na hata za kibiashara kutoka papa hapa nyumbani kwangu. Baadaye, Ninaitunza mwili wangu vyema kwa kuiweka katika hali iliyo sawa kupitia mazoezi ya mara kwa mara na pia lishe bora. Mwishowe, ninaungana na jamii yangu pamoja na marafiki zangu kupitia njia ya simu au mtandao ili kuzuia dhiki na upweke wakati huu mgumu. Kumbuka, haijalishi kama uko na virusi vya korona au la, salia nyumbani. Uokoe maisha.
I'm the director of the DM to Kenya. We established our company DM to Kenya in September in 2017. That is last September. And now we have this nails printer that can print any design on your nails within 35 seconds. That is our main product for now. Kenya began last September, and we're trying to propose a lot of designs about the nails for Kenyan women, because I found that they don't really have a lot of choices for nails in this country. So, but this printer, if you have it, you can print any design. So that is why we are here. When I came to Kenya for the first time, a lot of people just talked to me because of my nails, because I had a design nails. So I found out, okay, Kenyan women really interested in beauty. That's the first finding. And then next time I came here, I visited a lot of salons to get my nails done. And now I found out we don't have a lot of choice. I don't have a lot of choices for the designs. So I found the gap that people want a lot of designs, but the fact is the situation is the manicurists, they don't have a lot of skills about the nails for the small patterns. So I wanted to fill in the gap, and this machinery, even though you don't have a really long training, or even though you don't have a lot of skills or experience, you can just print with your smartphone. So I think this is the solution for this country to fill in the gap. This one, if you have the smartphone or any of these devices, if you download the app, and this machinery has Wi-Fi itself, so you can just connect with Wi-Fi. So it works like Bluetooth, and we have app as well. So you choose design from the app, and just print. Press the button for the print, and this one is going to print. And there's a camera inside. So if you have big finger, you can adjust the size through this camera. So you have if you have the big finger, you can just adjust to as a big size, and if you have smaller one, you can adjust as a small size. So anyone can print. Every time we just go to the salon, and if they're interested in, we just do the demonstration for them. And right after we did the demonstration, 100% people say it's amazing. And this is a lot of this is not time consuming, and this is the solution to get the specific design, because some people just try to do the design, but sometimes it's merged, sometimes it's it doesn't, they couldn't really do well. But this one is technology, so anyone can do the same print, same design, and also since this is only takes 35 seconds, it's not time consuming, so they finding this is a solution for their problems. You put your finger inside, yes, you can see, right? And you can just press down and choose a pattern. And just print. I did some research in Ethiopia, Kenya, Tanzania, Ghana, and we found Kenya and Ghana are the most potential. And especially in Kenya, here's the leading market in East Africa and Ghana, maybe Nigeria as well, but the Ghana itself also they have a really interested in beauty. So we want to start it with 2 branches, and after that we trying to expand it. So for me, I think I want to go to Tanzania, Uganda, and South Africa as well. And for the Ghana team, I want them to go to Nigeria and Algeria. Those are the west north side as our plan. In Japan, we have a long history, and first I'm sure that first they just start with the simple nail, but people like the very unique styles. So we just improve ourselves for the skills as a human being, just to improve the skills for the small patterns. But after we find this machinery, we found it's easier. So a lot of salons now you start using this machinery. But for Kenya, I think a lot of people don't have like high skills for this drawing the picture. So so this is their easiest solution to just buy it, and you can just use it from that day. I think the nail is very important because even Japanese have the word of the nail, the beauty comes from hand. And the reason why is even though I just read magazines, even just we type the laptop, even we just cook, every day, every second we see nails, we see hands. And if your hand is like pretty, I think it makes you feel very happy. And at the same time, if your nail is different from others, people talk to me, and I had that experience. So I think this is the start from the conversation, or start from the connection of the people. So I think the nail and hand is very important for women. Normally, people just do the base coat and color coat, and that's the same process. So we do the base and color, and we do additionally two steps. So nail mask is nail mask, and this PP is our technology just for this printer. Nail mask is the one to print your skin. So we put the nail mask for the edge of the nail, and you can peel it off later. And also, if you print without this PP, it's going to the ink is going to flip. So this is a special coat for